in the 5 months between when I got diagnosed and when I actually had surgery, we were able to shrink the brain tumor in half, which is an absolute miracle because the brain's really difficult with the blood-brain barrier and just treating it in general. So I did everything, and people always ask me, and I'll share specifically what I did, but people always ask, well, what do you think shrunk it? And we'll never know. We threw the whole kitchen sink at it. So I did everything from coffee enemas to hyperbaric oxygen chamber therapy, full body red light, a red light helmet, molecular hydrogen oxygen. I sit at my desk and I have this little oxygen machine, and I would wear my red light helmet. Before wearing the red light helmet, I would do methylene blue 30 minutes before to activate the red light, ozone, EBU. Welcome back to Take Back Your Health. Today's guest is Taylor Dukes. She's a wife, a mother of 2 boys, and an accomplished board-certified family nurse practitioner. She has more than 12 years of functional medicine experience. She has helped countless people discover the root cause for gut issues, skin conditions, autoimmune diseases, and more. Taylor, she was my nurse for many years before she started her own practice. And she co-founded a wellness center and curated a healthy living product line. She's battled cancer and used an integrative approach. And that's what we're going to talk about today. So welcome, Taylor. I am super happy to have you. Hello, everybody. Welcome back to Take Back Your Health with Dr. Amy Myers. Today's guest is a dear old friend and a colleague and my former nurse at Austin Ultra Health, Taylor Dukes. So welcome, Taylor. How are you?
Hey, I'm good. Thanks for having me. I'm honored. This is so fun.
Yes, no, it's my honor and privilege. So Taylor was with me for, I think you were my very first nurse. And then like many practitioners in my office, they went off to get higher degrees, which is so exciting. And then, opening up their own practices. And Taylor, I think you were one of the first to do that. So you went off, became a nurse practitioner, opened your own practice, and then here we are.
But I started with you, and that's where I literally learned. And so many people ask me, what certifications would you do? What programs would you do? And I always go back to you because I say the most important thing to do is to get clinical experience. So you were my first education in true functional medicine.
Well, and tell us, I like to always start the interview with just kind of your background, your story. So most of us that have gotten into functional medicine have our own health journeys. And I know I like to call it a journey because you and I have had, as many people do, continued, advances on our journey and health issues and getting back on track and all that kind of stuff. So we'll get into that. But first, why don't you just tell us how you got into functional medicine and your practice, and then we'll get into what you're doing now.
Yeah, you and I are very similar. I always say, and you always say, people are sick or they're smart to get into this. And you and I were both sick and desperate. I wasn't doing this
smart.
Yeah, and smart, but I wasn't doing this because I was trying to be proactive with my health. So I went to TCU for nursing school and just a traditional route of nursing. And then I had the opportunity to go abroad and do some medical mission trips in both Africa and Ecuador. And while they were amazing experiences, and I'm forever grateful for them, they've changed me as a person. I started having a lot of health issues after being abroad. And it wasn't just going abroad. I also was working trauma night shift ICU after I got back, which was really taxing on my adrenals and my immune system. And I'd also gone through a lot of trauma at that time. So it was just one of those things. It was the perfect storm, drops in the bucket. I was really, really sick. And I was going to all these different specialists, rheumatologists for my positive ANA, autoimmune stuff, gastroenterology, dermatology for skin. And I was going to everybody trying to get answers. No one could figure out what was going on. And I was living in Austin at the time. It was 2012, 2013 timeframe. And I'll never forget, my mom was really healthy growing up. And she was the one that said, Taylor, this is not you. You've never been the sick kid. We need to go to one of these naturopath, integrative, functional medicine doctors. And I was so desperate because I was so sick and nobody had answers. They were just doing procedures and putting me on prescriptions. And it was really confusing because here I was a nurse. I'm supposed to advocate for patients. That's my whole job. And I couldn't even advocate for myself. I was just lost in our medical system, which you and I both agree specialists have their time and place, but no one was really making headway or asking the why question. So my mom really advocated for me to see a functional medicine provider who I did end up seeing in Austin, and it changed my life and then changed the trajectory of my career.
And I remember getting better and being like, how can I make this my job? I got a nutrition certification, and that's when I found you. It was like a functional integrative medicine practice hiring. And so, yeah, I got into this just because I was sick and desperate, and it changed my life.
Awesome. And then after working with me for a couple of years, and I know, one of the really, I think, fun and great things about my practice was that everybody in the practice was living and breathing this way of life. As I was hiring, I would have everybody go through an elimination diet so that they knew exactly what all the patients are going through. And then, it was always fun. The break room had, always these very interesting, very healthy treats and things like that. Everybody brought their lunch. Times have changed quite a bit at my company now, but that was super fun. And so, I know that while you were working for me, you were living and breathing all of this. And then as many people in my practice did, they wanted to be able to help people even at a deeper level. And so you went back, got your nurse practitioner degree, and then you actually opened your own practice.
Mm-hmm. Yeah. So again, it was one of those things. I loved being a nurse, and the best thing I ever did was work for you and get that experience and learn not just how the system works from an integrative approach, but how to apply that knowledge like clinically. And yeah, so I went back to get my nurse practitioner degree, and it was just on my heart to start my own practice. And at the time I was living in Fort Worth, and there was really nothing like that. And this is 2019. I also co-founded a wellness center during that time. And it was amazing. I loved having my own practice. I loved being able to advocate for patients and provide the same level of care that I'd been given as a patient. It really is life-changing. And yeah, it was good.
And then we had a turn of events. Well, first you got married. You have two beautiful little boys. And then there was a turn of events. And that's really what we want to talk about today, because you've become, such an advocate now. Someone gifted you Pronovo, as I understand, and then they uncovered something. So do you want to tell us about that?
Yeah,
as I get tears in my eyes.
Too. It makes me kind of have a lump in my throat every time I share this, but I was gifted a full body preventative scan by the grace of God. I'm so grateful. And it was, Pronovo, which is a full body preventative scan. It's an MRI technology. There's no dye, no contrast. And they have a location in California at the time, and they were moving to Texas. And they simply said, hey, we're moving to a location in Texas. We know that you have a practice there. We'd love for you to experience this to share with your patients and your online audience. So I was breastfeeding my 10-month-old at the time. I had no concerns, no health issues. At this point, I'd gone through my health journey, part one. Sure. And I'll never forget getting the notification that they had an abnormal finding and that there was a brain tumor found on the scan. And that was September of 2022. And I remember looking at it thinking, there's no way this could be me. I have absolutely zero symptoms. I'm going through the Rolodex of symptoms of a brain tumor. I have no headaches. I have no personality changes. I have no hearing, no vision, nothing, And so at first I was in disbelief, but as we did a further workup and I was able to meet with specialists, we did confirm that I did have a brain tumor in my right frontal lobe.
And can you tell our listeners what type of brain tumor?
Yeah. So at the time when I got diagnosed, to get a true diagnosis, you have to get pathology. And so my journey was a little bit different. We knew that it was a glioma of some sort. Of course, you're given differential diagnosis, which in the medical world, that's just a term for a list of things that it could be. So it had some pretty scary things on there: glioblastoma, metastatic disease, lymphoma, and then, several different types of gliomas. I ended up having an oligodendroglioma, which is a type of, brain tumor. So it was primary brain tumor, which means it's isolated to the brain, so it's nowhere else in my body, but that was the official diagnosis.
And so, you say brain tumor. Did they use the word cancer, or did they just continue to use the word tumor, or how were the doctors speaking about this?
Yeah, so I guess I'll just walk people back to kind of that experience. So when I got the results, I knew I needed to see a neurosurgeon. So I consulted a guy locally days after I got the report. And he basically said, again, this is September of 2022. And he basically said, we don't know if it's cancer or not. We'll have to have pathology to find out. It wasn't enhancing, which means it didn't light up like a Christmas tree. It wasn't super vascular. He said, so it is very concerning given the size. It's a matter of time before you become symptomatic. But, you're not symptomatic, so we don't have to rush into surgery tomorrow. And so I just kind of took time to pray and slow down and just reevaluate every aspect of my life. Again, I had 2 kids, like you had mentioned. I had a husband. I had multiple businesses. I had to get my husband access to bank accounts. I had to execute a living will. There were a lot of life things that had to go on. So in some ways, it was a blessing that I didn't have a seizure and wake up in the hospital and just get the next on-call surgeon. But it was also scary because I knew I had this thing in my brain. And so, yeah, I didn't rush into surgery. I really got a lot of second opinions and did a lot of research. And again, I had already gone through my healing journey and I thought, what? I was so confused. Like, I thought I was healed and I felt good. I had no symptoms. I was doing great. But the reality is, it was a ticking time bomb. And I'm thankful it was revealed the way it was. So I had time to advocate and do research. But yeah, I didn't jump straight to surgery. I went to Hope for Cancer, which is a integrative holistic center in Mexico. I got on a plane and flew out to the Cancer Center for Healing in California. And from the get-go, I took an integrative approach. I established care with Remission Nutrition. They do a lot of oncology nutrition consulting. And even though, again, I knew a lot about nutrition, I knew nothing about cancer. I feel like I have my PhD in it right now, just from learning as a patient. And like you, we do research. But so I got into a metabolic ketosis state. I went to different centers. I implemented a lot of therapies. And then I did end up undergoing brain surgery 5 months later on February 1st of 2023. And I found an amazing brain surgeon in Arizona that Naisha Winters referred me to. So that is when I got the official diagnosis and the pathology that it did end up being cancer. But before that, everyone said, like, it's probably low grade, small, like growing a little bit slower than normal. So no one really thought it was cancer. So when we got the pathology that it was a grade 3, it was a little bit shocking. But yeah, and I still am very careful to use that word. I just feel like with the word cancer, and when we say that and speak it over ourselves, it just feels really heavy and hard. And yes, I've gone through a cancer journey, if you want to label it that way, but it's just a hard thing to have that spoken over you. And so I try not to identify with that too much, of just like making it my identity that I'm a cancer patient. I'm a warrior. People are like, you're a survivor. I'm like, no, I'm a thriver.
Yeah.
But yes, it did end up being cancer.
Yeah. Yes. The only reason that I ask is, I recently shared my story and my scare on Naisha's podcast where, and you and I, my story where I had a blood test that showed that I had some circulating tumor cells and, was just thinking to myself, the word cancer is just so huge. And I mean, there are people today that could be getting diagnosed with MS or, ALS or an autoimmune condition that could be so much more impactful in your health than, certain cancers and certain stages of cancers. But just the word cancer. So that's why I was asking, because it, at least for me, was, it put me to a place that I've never been before. And I had to pull up my big girl pants and say, I've reversed my own autoimmunity. I've helped hundreds of thousands of people reverse autoimmunity. Who thinks that I can't, take care of whatever this is? And so it's probably, as you said, a real blessing that almost you didn't know the extent in the medical, in the conventional medical community that you say it's a grade 3, that you didn't know that, right? That you got to sort of I certainly don't want to say ignorance is bliss because, but no, you were spared that in order to, in order to get well. And I know for me, I did a number of things and then, repeated my test and it all came back negative, and just the weight off of my shoulders since then and the way that I'm going through life and my level of stress has diminished. And I do think, perhaps for you that was a huge part in your healing to not have that weight of that diagnosis.
Absolutely. I really do believe, words have power and our minds have power. And I've always known that, but I feel like my eyes have been opened in a whole nother way. And I think of these cancer patients that have had this spoken over them, have had prognosis spoken over them, have had statistics spoken over them, and then they start chemo and they start losing their hair and they start identifying with that. And I just think that is such a hard mental battle to fight. And don't get me wrong, I'm super optimistic. I've always been optimistic. I have my hard days. It is freaking hard. There's no other way to put it. I mean, sometimes it hits me. I'm driving down the road, I hear a song and I lose it, and that's just part of this curveball of being thrown this curveball. There's grief, there's shock, there's overwhelm. But again, like you, it's one of those things. We are so blessed to have the resources, the colleagues, the means to be able to pursue it from this integrative approach. But even with all of that and hope and optimism, it's still hard. And for any cancer patients listening, like I feel that. I've never understood, but now I get it. I really do get it. And I think it's changed my life in a way that I'm grateful for the way it's changed my life. Although I wish this was never my story. I never would have chosen this. I view life completely differently. Like I have life through a new lens, even as a mom of young kids. I mean, they drive me crazy sometimes. Let's be honest. We're all moms. But instead of saying like, oh, I have to do this, or, oh, my kid woke up in the middle of the night, I have to go soothe them, I get to do it. It is an honor and it is a privilege. I'm here. I've seen moms lose their battle to cancer, their earthly battle, and it's not lost on me that every day and every moment is such a gift. And so I'm grateful for that, but it's still really hard.
It is. Well, why don't you tell our listeners some of the things that you did at, I believe you said it was Hope for Cancer, which is in Mexico, and then, of course, Dr. Keneally's place, Center for New Medicine out in Irvine. Why don't you tell us some of the natural, holistic, integrative treatment approaches that you did prior to your surgery? And then we can, of course, get into the things that you do now.
Yeah, because there's maintenance. It's not over.
Yeah.
So I'll share all of that. And I do want to share that in the 5 months between when I got diagnosed and when I actually had surgery, we were able to shrink the brain tumor in half, which is an absolute miracle because the brain's really difficult with the blood-brain barrier and just treating it in general. So I did everything, and people always ask me, and I'll share specifically what I did, but people always ask, well, what do you think shrunk it? And we'll never know. We threw the whole kitchen sink at it. So I did everything from coffee enemas to hyperbaric oxygen chamber therapy, full body red light, a red light helmet, molecular hydrogen oxygen. I sit at my desk and I have this little oxygen machine, and I would wear my red light helmet. Before wearing the red light helmet, I would do methylene blue 30 minutes before to activate the red light. Ozone, EBU, which is just like ozone on steroids. It filters out your blood and oxygenates it. I took hundreds of supplements, way too many. Not way too many. I'm grateful because, again, it all played a part. I did take pharmaceuticals. So I don't know if you've talked about repurposed or off-label drugs when I'm here.
Not really. No, I need to know.
Yeah. Well, so
I'm familiar with it, but
yeah, it was new to me. But for anyone listening that hasn't heard of it, essentially there are meds that are not FDA approved for the purpose of some certain tumors or cancers. So they're FDA approved, but you're using them off label for the purpose of blocking certain metabolic pathways. And so I was on all sorts of anti-parasitic prescriptions. I was even on things to help with my blood sugar, to starve glucose to the tumor. I was on all kinds of things. So therapies, prescriptions, supplements. I even, I was already so healthy. My house, we filter our water. I eat healthy. I take supplements just for general well-being, but I really up-leveled everything. And then again, I eat so clean and healthy. We try to eat organic. It's not perfect when we eat out. We have seed oils, it's not ideal, but we also live our life and make memories. And that's part of healthy medicine too. And so I really dialed in though with my diet. I got in metabolic ketosis. I was tracking my blood sugar, my glucose ketone index. It was really exhausting, to be honest, but I did what I had to do. And yeah, we busted out the entire kitchen sink.
And what about IVs such as vitamin C, glutathione? Did you try anything? I don't know, for brain tumors like mistletoe?
Yeah. Certain things there's either not enough research or there's not enough evidence to show that it affects the blood-brain barrier, but we still did so much. So I did poly-MVA, high-dose vitamin C, artesunate. When I was in Mexico, you can't get it in the States, but I did something called B17. It's just a B vitamin. It's found in apricot kernels, but just like we have B2, B3, B6, B9, B12, it's a B vitamin, it's B17, but it's not allowed here in the States. So that is an infusion that I would do there in Mexico. But we did all sorts of IVs, ozone again, and yeah.
And the one thing that I didn't hear you say, but I know likely was a huge part because I know how your relationship with your faith is prayer.
Yes. Oh, yes. Prayer. And people would always ask me, how are you doing it? And I'm like, I'm not. I really do feel like God is giving me strength beyond my circumstances and hope to see beyond my circumstances. And yeah, I think also as a young mom, like I just had such a strong will to fight, and I still do, to fight for milestones for my kids. That's what always is hard for me, is that I don't want my story to end this way. I want to be the mom that is there at my kid's graduation. I want to be there at my son's wedding. I want to be there for the milestones. And so, yeah, I just have such a strong will to fight. And God really has given me supernatural peace. I don't always have peace. Of course, I experience fear and confusion, and I ask the why question, why me? But yeah, I've spent a lot of time in prayer, a lot of just like, God, I don't know why you're allowing this to happen, but I trust you. And I will say, being on the other side, 2 years out from my diagnosis, still fresh, I'm still in it. I've seen so much purpose in my journey of how God has used it to help others and encourage others. And so I do see a lot of purpose, and I find a lot of purpose in it, even though, again, I still wouldn't have chosen this.
Mm-hmm. Yeah. I mean, I can definitely, being an older mother, and, my mother died of pancreatic cancer at 59, and I'm 55 now. So, I before I even had that blood test, I just do all of this stuff like you do for prevention, and check out any kind of new labs that come out. I mean, I'm always the guinea pig, on myself. And so, those milestones are so important. And I'm always thinking about them, just being an older mother and having, had my mother die at such a young age. It's really important. And you can get kind of overwhelmed by it, right? Of just thinking too much about it.
So many tears, were we?
Oh, I know. I'm like, and I didn't even, my Kleenex is way over there. I probably should have gotten that.
Period. I'm about to ovulate.
Yeah.
It gets you sometimes,
Oh, of course. Kiddos, of course. So since then, I think you kind of reevaluated certain things in your life and what was most important to you. And having done a similar thing myself, of once Elle was born and having recovered from a toxic mold situation, to make the difficult decision to close my clinic in order to, be a mom. And I know you made that decision. Can you talk to us about that, and, how you came to that decision and where you are now?
Yeah, it wasn't a decision that came lightly. And just like you, I mean, there was a huge demand. You constantly had a wait list at your practice. People would travel. I remember there were people that came from like Saudi Arabia, Australia, and so I was so blessed. I had a huge wait list. I had hired multiple providers to help kind of accommodate and meet the demands of people that wanted care. And ultimately, I can't believe I did it, but it was absolutely the right decision. And I'm so thankful that I had the confidence to make that decision. And I just kind of came to the point where I could help everybody else at the expense of what? And when I don't take care of myself, I suffer, my family suffers. And so cancer was really the curveball that ended up being kind of a blessing to restructure my life and prioritize what matters, and not that caring for patients and having a practice didn't matter. It just, at that time in my life, it didn't make sense. And so while it was really hard, I closed down my practice. I also took a little bit of a leave of absence as the co-founder of the wellness center that I had started. And thankfully, I had a partner that was really, I was able to take time off. And after surgery, I was just having, and again, no one can prepare you how a brain surgery affects you. People are like, well, you're good. You got out of the hospital in 24 hours and you didn't need PT and OT and speech. But still to this day, I don't want to call it deficits. It's just a difference. I can't spend too much time in front of the computer. I can't do too many overstimulating things. And so I just remember being a couple months out from brain surgery, not wanting to pressure myself to get to this certain level where I could get back to work. And I really wanted to enjoy my kids. And so I made the difficult decision to walk away from owning the wellness center. And it was hard because it was everything that I'd worked for all these years of going to school and investing in my education. The same thing. You went to medical school. I didn't even do that. But it kind of was like, what? I've worked hard to walk away from this. But yeah, it was absolutely the right decision for my family and for myself. And at that point, healing was a full-time job. I mean, the therapies that I would do, how I would eat and prepare my food, it was pretty full-time.
And so now that you're 2 years out and in maintenance mode, I know you do spend a lot of time still doing many of the modalities, and I know you still have a clean diet, but can you kind of walk people through what maintenance looks like for you in terms of diet, and as well as kind of what your maintenance schedule from a health perspective is?
Yeah, that's such a great question. So I definitely am living life a little bit more like I'm healed, because I really do think our body follows suit. And I remember it was last summer, I was 5-6 months after brain surgery, pricking my finger, doing the metabolic ketosis. And I'm not saying do what I do. This is just what I feel personally is right for me at this point in my journey. Now, if I had true active cancer, I would be probably doing something different. But I remember traveling and we were making memories as a family last summer. And I remember feeling like I was just a slave to my diet and it was sucking the life out of me. And so I kind of reevaluated and, I'm like, okay, I have no tumor. I have no evidence of disease. Of course, I'm still being monitored. Of course, they say you're never cured with brain cancer because there's always cells. So I do certain things like fasting. I definitely do just eat lower carb because I don't like a lot of starchy carbs. I don't like, sugar really. Every now and then I'll have a treat because I'm normal. But I just remember feeling like I need to live life like I'm healed and make memories. And so I still do a lot of therapies. I get ozone every couple weeks. I have been on a lot of targeted protocols and doing lab testing. And I know when people hear my story, they kind of freak out because they're like, well, you were the healthy one. What do you mean? You had cancer? And I think something to highlight and that's important is that there's a cancer cascade that happens and it doesn't happen overnight. Just like with autoimmune disease, symptoms may be triggered suddenly with a traumatic event or stress, but it's drops in the bucket. And there are multiple contributing factors. That's the same with cancer. And so when I was really sick, that is when my immune system was very suppressed and these cancer cells started to form and my immune system was not able to take care of that. So the tumor had been growing likely 8 to 10 years is what people said. And so just for anyone listening that's really freaked out, like what's in my body if I'm healthy, I just like people to hear that it was growing for 8 to 10 years. And so our goal right now with what we're doing for prevention of recurrence is really getting my immune system back on track. And so I have a super suppressed immune system. What we're working on currently is addressing Lyme and co-infections. We track something called a CD57 and mine is super suppressed and low. It's my natural killer cells. You used to check that back in the day on patients. So again, it's things that I've learned over the years that we're having to implement in a different way with cancer now. And so, I'm doing a lot of ozone. I'm starting some specific therapies to target the co-infections and Lyme markers that I have. I'm on herbal protocols for that. I'm doing ozone. And again, in the integrative world of cancer, it's not just like, yay, you have a clean PET scan or you have a clear MRI for your brain. It's asking the why question. Why did this occur in the first place? And how can we fix your immune system so that it doesn't come back? So yes, there is a celebration after surgery and my friends threw me a huge party and all of our friends and their kids came and we had a weekend to celebrate. We called the brain tumor. I don't know if you know this. We named her Helga. So sorry if there are any Helgas out there, but we had to name it, claim it, get rid of it. So they had a huge Helga eviction party and we celebrated because it is something we're celebrating. But again, the work is not done, not to be morbid, but that's why you have to take it from an integrative approach because you want to prevent recurrence. So often you hear about someone that's diagnosed and they're in remission and 3 years later it comes up even somewhere else like ovarian and breast. So that's what I'm doing. I'm preventing recurrence. I still eat super clean. I implement some fasting, and it's not like full day fast, although that is good for you with water sometimes done appropriately with electrolytes, but I'll, have an early dinner and then sometimes I'll fast till noon the next day. And that just kind of helps with autophagy and cellular health. I do red light bed every now and then. I do sauna a couple times a week for detox. And a lot of it's just maintenance, but specifically targeting boosting my immune system.
And I guess a question that I didn't ask you was, what did, with what you had, what if someone wanted to have gone the conventional route, or was there something recommended to you? And was that chemotherapy and then surgery or radiation and then surgery? What was offered from a conventional standpoint for you?
You're such a good question asker. I've learned a lot about my story, but I'm like, these are really pointed questions. I can't wait for people to hear this. So with my story...
And I don't have any notes.
I know. This is off the cuff. I'm actually really impressed. So, but we know each other, but you're a great interviewer.
Thank you.
My brain surgeon, I will preface this with, he is definitely more open-minded. He wanted me to get in ketosis. His name is Chris Smith at Barrows Neurological in Phoenix, Arizona, if this resonates with anybody. But anyway, when he got the pathology, he said, I'm very shocked it's cancer. It didn't present this way, but because it's grade 3, the World Health Organization has to label that as cancer, even if only part of it was that. So he said, I know that you're doing all the integrative stuff. I'd like to see you pursue this. I don't want you to start chemo. I don't want you to do radiation. He said, I'd like to keep that in our back pocket for recurrence because you can only do it once with the radiation.
Okay.
And so thankfully, I did not feel pressured to do that. And then I did establish care with a neuro-oncologist. I'm here in Fort Worth, in Dallas, at UT Southwestern, just in case, I needed someone locally. It made my husband feel comfortable having someone. And I remember being so nervous going to her office thinking, is she going to totally call me crazy? This was 6 months after my brain surgery for not doing chemo or radiation. And I'll never forget, it was the biggest weight lifted off of me. She said, I am so glad that you did not do chemo and radiation, even with this grade 3. And I was like, what? I was just not expecting that. And she said, you have the IDH mutation. You had a full resection. We really have to look at each individual case. But technically, traditional standard protocol is the second you have a grade 3, you do chemo and radiation. But thankfully, and maybe I kind of cherry pick my team a little bit, but she still is very traditional. I have friends that have gone to her that she's recommended chemo and radiation for. But she met me where I'm at, and she just said, no, you have the IDH mutation. You had a full resection. We need to keep watching and waiting. And there are some drugs you can do for targeted mutation therapy, which I have not done. I'm still thinking and praying through that. But at this time, I don't feel like that's right for me. And everybody's individual. They have to make their own decisions with the education they have and do research and talk to their team about it. But technically, grade 3 does qualify for chemo and radiation. But in my case, the 2 providers that I consulted with and Dr. Canale was in agreement. So I had 3 people, which was also a blessing for me that I didn't feel like they were telling me to do this and fear-mongering me and pressuring me. I had a resounding, yes, you're doing the right thing. Keep doing it. Right. But most people would just go live their life, which is okay too. But I'm also busting my booty to still support my immune system and heal. It's not over. And February will be 2 years since brain surgery. So and I also had breast implants. I also got those out because that's a foreign object.
Yeah, I never knew that about you. I saw that on Instagram.
You're conservative. But anyway, I did have those removed. And so I've gone to great lengths to heal because I want to live a long life and I want to be healthy and get rid of anything that's hindering and suppressing my immune system.
And so the traditional course would have been to just go have surgery, figure out what it was, and then chemo or radiation. They don't recommend chemo or radiation to try to shrink a brain tumor and then resect it.
I think it depends on the location, but because mine was in a very resectable location, which resection, for those of y'all that aren't medical, it's just to be able to remove it and get clear margins. But some are in really risky areas, so they might automatically do that. But for me, that was never really the case. And people thought I was crazy for waiting 5 months before brain surgery, but I was so grateful that we were able to shrink it because I'll never know. What if they were able to get clear margins? And we don't have to play the what if game. We get to just celebrate that my story is what it is. But yeah, some people, I bet they do recommend chemo and radiation before surgery to get better margins.
And so let's talk about that. I mean, obviously your mother recommended early on functional medicine to you. You changed your entire career. You'd gotten better through functional medicine. I know you met your husband or your now husband, while you were already in this world, but were there any skeptics in your life, friends, family, even perhaps your husband that was like, okay, we support what you're doing as a, career, but now that you have this brain tumor, we don't support it? I mean, or did you have resounding just kind of support the whole time?
I felt like there were a few people in my life that probably thought I was crazy, but weren't saying it, but I actually never had a sit down with anybody that was like, I think you've totally lost it. This is cancer. This isn't gut problems. So I was very protected. Again, you see protection a lot throughout my journey of just I was protected from knowing it was cancer. I was protected from critics or fear mongering. And so I will say my husband's mom was diagnosed with stage 4 non-smoking lung cancer when he was in college and pilot training. He was an Air Force pilot. So he saw his mom battle cancer doing a holistic integrative approach for pretty much 4 years. And then she went downhill and she ultimately passed. But he saw her do chemo at the end and some clinical trials, and he said it was just really hard on her. So thankfully, he has been very supportive. He has been like my rock and my advocate, and he's been all for it. He's like, you need to go to Mexico? I'll take the kids. We'll figure it out. So he has been such a blessing in this journey, and my family's really supported it. But yeah, I'm sure people thought I was probably a little bit crazy just knowing this is the C word and this is a big deal, but I never really had a sit down where someone was like, I'm concerned about your mental health, that you're not making good decisions. So I'm sure it was there, and there might be someone listening that's like, yeah, I thought she was totally crazy, but I didn't experience that for myself. And again, we just were making decisions with the wisdom and knowledge that we had at the time.
And now you are, have a large social media presence and you're really educating people about all of the things that you're doing in cancer. And, I think being a massive support for people, to potentially treat things in a more integrative, holistic, functional medicine kind of way. Can you tell us about that and some of the offerings that you have?
Yeah, so I'm so passionate about education. And even when I had started my Instagram years ago, it was like 10 people were following me. I'm like, do people even care about this stuff? I don't know, but I'm passionate about sharing. And so I've always been passionate about educating and equipping and empowering people with information. And this was long before I had cancer. But really, when I got cancer, I'm not telling people what to do. I'm not giving medical advice. I'm just sharing my journey in hopes that it helped people. And it did grow. And of course, encouraged a lot of people. And I know a lot of people have gone to both Hope for Cancer and Dr. Keneally's clinic because of my story. And so I'm grateful for that. I'm not saying it's the approach for everything. I think everybody has to look at each individual case and basis. But yeah, I've just been always so passionate about education. And I have a blog. We do articles and just showing up on Instagram. A lot of it's just sharing my journey and educating along the way because I'm just so passionate about that. And, people learn through our struggles.
And your boys are still young. How old are they?
So 3 and 5.
3 and 5. So, do they even know about this journey for you? Like how did you approach that with your children?
So the weekend I was diagnosed, my youngest was 10 months old. I was still breastfeeding. Total curveball. My oldest, it was his 3rd birthday weekend. And I can say to this day, they knew I had brain surgery. I couldn't lift my baby for weeks after brain surgery, so I had staples in my head. So my oldest, he was 3 when I had the surgery. And so he'll sometimes say like, oh, I'm learning about the brain at school. Remember when you had brain surgery, Mom? And I'm like, yeah, buddy, how does that make you feel? Do you want to talk about that? But we don't. My kids don't know what cancer is. They don't live in fear that mommy has cancer. And so while it was the hardest of times to be diagnosed, sometimes I'm like, come on, God, couldn't I have been like 50 or 60 when this happened and have grown children that have all these memories with me? But then at the same time, I'm also grateful because I feel like they've been sheltered and protected from a lot of what that is. And, I have other cancer mom friends that it's so triggering. Their kids are older and they watch a movie and someone dies of cancer. And so they think their parent's going to die. And so in a lot of ways, I feel very blessed that my kids don't know what it is. They probably know that something's different. Like I go to appointments and I had breast explant surgery, but they don't really know what that is. They've really been protected from that. And I think as they get older, it's something that we're going to share. And hopefully it's all a victory story that we get to all celebrate together for the years to come. And we'll probably have to have a sit down at some point to share that with them. But for now, they know I had brain surgery. My oldest definitely remembers little bits and it comes up every now and then, but it's been a while. So I'm grateful that they're really protected for the most part.
Yeah. Elle, I guess I'm trying to think how she found out about Princess Kate, having cancer or something. I don't know, a magazine. I'm not really sure, but it's like, oh, that's the real life princess. And then somewhere, somehow she found out she was sick. And then I was in Austin to go get my annual mammogram, which I will never do again, QT scan all the way, and thermogram. But, at the time, I didn't really know everything that I know now after my own scare and journey. And so Elle was with me because I didn't have any childcare. And she's like, well, what are you doing? I was like, oh, just this thing, that you do every year to just make sure everything's okay, And she's like, you don't have cancer, do you, Mommy? And I was like, oh, no, sweetheart, everything's, or maybe she didn't use that word. But I was like, everything's fine, And then I get called back for the mammogram. And, everybody can listen to my podcast with Nation. I'm going to do a solo cast on this. But anyway, to tell the whole story. And then, for months, I'm going through this thing and not telling her, right? And so it's just really hard. And then the day that I get the negative result and that everything's fine, gone away, who knows if it was ever really there, whatever the situation was, it's no longer. And I mean, I am literally crying tears of joy. And she's like, what's up, Mom? I'm like, oh, I just got some really good news. She's like, about what? And I was like, oh, it's just too hard to explain, but just really, really good news. I mean, I think it for me at least, and I didn't have what you had, just keeping that from my child was, and carrying that burden that something significant could be going on. And, as a mother with small children, the weight and all the thoughts that are going through your mind, as you said, what milestones am I going to be here for? And have to have the brave, nothing's wrong face.
Okay. Yeah.
Yeah.
Which I did tell them, like, I cried a lot in the beginning, and it was like saying bye to them to go to brain surgery. Oh my gosh, that was the hardest thing I've ever done. Because I'm like, am I going to be normal? Am I going to is mom going to come back as they know it? And I remember that was the hardest thing I did. But I would just tell my kids when they'd see me cry, it's okay to be sad. Sometimes mommy gets sad and it's okay, and like validating those emotions. But I had a lot of shower cries, and I would just feel like a new person. I'd get a weight off me, a lot of closet cries.
Yeah.
And then, I just, I would tell them if they saw me crying, it's okay to be sad. It's okay to have feelings sometimes. And we got through it, thankfully. But yeah, it's not easy. And then I also, this is something that kind of sounds depressing, but I started letters to my son. I got them individual journals, and now I love it. And it has nothing to do with cancer, but cancer motivated me to do it. I'm writing down like sweet memories and milestones, and you did this at your first baseball game, because I wanted to document that for them, not knowing how long I'd be here. So it was a little depressing in the beginning, but now it's turned into this like joyful, sweet thing that I can't wait to look back when they're older and just be like, hey, buddy, guess what? This is what you did, and I would have never taken the time to write that down.
Yeah, no, that's really awesome. I know when my mother was diagnosed, I think the book was Tuesday with Maurice had come out. I don't know if you're familiar with that book, but it was a gentleman who had been diagnosed with cancer, and he has these interviews or something every Tuesday and is talking about his life. And, when my mother got diagnosed, it was stage 4 pancreatic cancer. And I wanted her to, go see Nick Gonzalez, and who is no longer, but he was doing, a lot of great work in the integrative field with stage 4 cancers. And she opted for conventional chemotherapy. And, I really think that killed her quicker than if she had done nothing. And there was no Tuesday with Maurice happening. I mean, there was no, memories. And it was literally survival mode the minute that she started doing chemo. And so it's amazing that you thought to do those things and that you're still continuing them.
Yeah, no, that's where I'm like, there are sweet little blessings that's come from that. And I keep having to remind myself of that. I call them little God winks. I'm like, all these little purposeful things along this journey. It's just a little God wink. And I think that's also what keeps fueling me of like, life is different. And in a lot of ways, it's been really hard, but in a lot of ways, it's really sweet. And I have to reframe my mindset about the things that I'm grateful for and the things that this has taught me, even though it feels over in some ways. But then I also have a scan coming up in January, and it's this pending sense of doom where I'm like, this is my story. But I will say, the further and further I get out, I remember talking to people that are like 3-4 years out being like, how is this not all consuming? How does this not give you anxiety all the time? And I remember them just saying it does take time. And even though I'm almost 2 years out from surgery, I have my moments, but more so I have more good days than hard days. And I really I'm grateful for a lot of the things that I've learned along the way.
Mm-hmm. Yeah, my sister, who you have met because you were both, at my wedding, my half-sister is stage 4 breast cancer and has a PET scan today. And I'll start crying. As I was going to bed last night, just, praying and meditating on her having good news, I couldn't help but, put myself in her shoes and just what she must be thinking and feeling going into that scan,
It's a huge one.
Yeah. And so do you have any advice for people as or things that you do that have helped you as you're going into these scans or any kind of testing, right? I mean, we're all the same. I mean, when I got my
biopsies, circulating
cells, when I got that lab test and, I was in Austin and it was like, here are your results. And I'm like, oh my God, pressing the button, waiting for it to download. And it's just like, is this going to be, what kind of day is this going to be?
Yeah. And I wish I could say I have it figured out and here's my protocol. I really don't. I do good for the most part. I think mindset is so powerful. Even if someone is given a poor prognosis or a poor diagnosis, there's always hope. As long as you're breathing, there is always hope and there are always options. And so don't lose sight of that. Don't give up. I still get anxious when scan days come around, but I live my life like I'm healed. I really do. And I don't let a diagnosis define me.
and give yourself time and space to grieve and be sad and question why this is happening to you. Like, give yourself time to do that, but don't stay stuck there. I would notice when I would stay stuck in that place, my husband was really good. Like, let's go on a walk. Let's go listen to worship music. That turns you around. Go do something for yourself. Go get a massage. When I would do something to not stay in that place, that's when you stay in that place, that's when you spin. And that's when it gets unhealthy. And then you go down the what if rabbit trail. And so, but I also know it's such a heavy and hard thing to have spoken over you, or if you're diagnosed or whatever, you still have to grieve. You still have to be sad. You can't just look past it and be like, get over it, be hopeful, trust God. It's, while you can do those things, you still have to give yourself time to grieve. And so, but just don't stay stuck there is what I would say, because that's usually when people spiral. And no man, no diagnosis, no test, no statistic has the ability to figure out the number of your days. And so don't let that become what you believe and what you think and how you live. Like, oh, I'm going to die in 6 months, because your mind is powerful and what you speak over yourself and what you believe is so, so powerful. And again, mine is prayer. And when I'm in the MRI machine, I always ask to turn on my Jesus jams. I say, just turn on some Christian worship playlist. And that just kind of recenters me. And I joke, I'm like, what kind of list is DJ Daddy God going to put on the mix today? And it always seems to be a song that just like really speaks to me, that if I was driving down the road, it would be different. But in that moment, that's personally just what helps me. But yeah, just not staying stuck there and just really continually renewing my mind to have strength and hope beyond my circumstances.
And MRIs, so that's what you're doing for surveillance in terms of imaging. And do you do that with contrast, or they're able to do that without contrast for you?
Yeah, so my neurosurgeon's really great, and he's allowed me to space out the MRIs, not because I'm telling him, but because he says that. And he likes me to do it once every couple years with the contrast, which, as we know, is gadolinium, which is a heavy metal. And so the times that I do it with the dye, I think the further and further I get out, he'll let me do it less. And thankfully, I'm not doing it every couple months with the dye and the contrast. But the days that I do that, I'm a little more mindful of my detox and taking binders and sweating and sauna and flushing that out. But I am really fortunate that because it's an MRI, it's magnetic imaging. So it's not, a PET scan or a CT scan that does use radiation. I did have to do a CT scan in the beginning because they want to get a better look before surgery at the vessels and the blood supply and everything. But yeah, and you can advocate. A lot of people don't realize, you have to be careful because some oncologists and providers will technically fire you if you don't follow what they say. But you'd be surprised if you could advocate, especially when it comes to brain imaging. Can I do every other one with contrast? Of course, you're at the mercy of your provider, but my surgeon's he still wants it every now and then to have a good baseline. And also, I never had radiation. So sometimes when you have radiation necrosis and you can't tell if things have grown. But my imaging is just super clear. So thankfully, I don't have to do the contrast every time.
Yeah, good. Well, before we part ways, I like to ask my guest, what are 3 ways that you would encourage our listeners to take back their health?
Yeah, you come up with the best questions. And I have to say, I think people overcomplicate health. I really do. I think we get so fixated on this diet and this supplement. And I always say, get back to basics. And so with that, get back to basics, I think sleep and stress is so huge. And we undervalue that because we want to buy something. We want to buy a gadget. We want to spend our money on something, which there are times and places for that. But mitigating stress, dealing with trauma, sleeping, that is so huge for any health condition. Getting sunshine and fresh air, that is so important. And a lot of these, again, are free medicine. And then I think just clearing out the toxins in your home, whether that's your diet, chemicals in your cleaning products, personal care products. So those are a lot of different things. But in summary, focus on sleep, stress, and trauma. Get rid of chemicals in your home and your diet. And then, just eating super clean.
Awesome. So how can our listeners find you?
So I have a website. Again, I'm so passionate about education. That's just my name, TaylorDukesWellness.com. And then I also have an online store with a lot of supplements and products. That's shop.TaylorDukesWellness.com. And then I'm on Instagram. I love just sharing life and everyday health hacks, especially as a mom, things that we do for our kids. And so on Instagram, it's just Taylor Dukes Wellness.
Awesome. Well, it was so great to catch up with you. And I'm so happy that you're doing so well and that you're, turning these lemons into lemonade and helping other people by sharing your story. So thanks so much.
Thanks for having me. I'm so honored. And thanks for being a great voice of reason in part 2 of my healing journey. I know we've talked a lot about cancer stuff and resources and testing and supplements. And so I'm grateful for you as well.
Well, thanks. All right, take care. I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.